Softball was my life before it all went down. I was literally picked up from softball practice by my dad, and he's like, well, we have to go to the hospital.
It's hard to completely describe how terrifying it is to be told that your child may have a catastrophically serious illness and to have your life changed literally overnight.
I was diagnosed with leukemia my sophomore year of high school.
Emotional safety is a practice where we are promoting health and trust with our patients and families.
When you get this diagnosis thrown at you and you're told you need to go to the hospital and plan to be there for 30 days, the lack of control is huge.
What we know when families don't receive the emotionally safe care that they deserve is that it really can have a long-term impact on them emotionally and on their physical health as well.
She was put into a room to do a bone marrow biopsy. The nurse blurted out, "Did they tell you what type of chemo?" And Mandy freaked out. She said, "I have cancer?" That is not the way a 15-year-old child should hear that they have this life-threatening illness.
Child life specialists are crucial and important because their job is to ensure that children feel emotional safety when they are in the hospital setting.
Yeah, we didn't know anything about child life until we were put into that world.
I was like, wait, this is like an actual job?
When someone comes in and they explain to you on your level with bears or music, it's amazing. I have seen where child life has been the defining reason why a child was able to go into surgery calm as opposed to terrified and confused.
She would distract Mandy, she made Mandy laugh.
I remember she held an iPad for me like the whole time, watching Friends while the procedure was going on.
The partnership between the caregivers, the nurses, the physicians, and our Child Life team is really extraordinary. One of our biggest challenges is making sure that Child Life is viewed as not a nice to have, but a must have. The Child Life Association and some of the new initiatives like the Emotional Safety Initiative are absolutely key because they bring a national recognition, a national standard of excellence for the practice of child life.
With ACLP's work and with the emotional safety paper, it's really explaining on a level for clinicians who are bedside working directly with patients and families, specific things that they can do to help, and really tie the importance of emotional safety to the importance of physical safety for patients.
The most impactful thing that Child Life did for me is just give me peace of mind that Mandy was being taken care of while I was away talking to a doctor, because it just brought so much more peace for both of us, really.
I think one of the great metrics of the positive impact of child life may very well be how much more cost-effective our care can be.
If it takes 45 minutes to start an IV line and it could take 5 minutes because a child life specialist has prepared a child, it's amazing. So it actually saves money.
I can't imagine our children's hospital without Child Life. And in order to ensure that that goes forward, we need stable funding streams. We need support and education in place. I think by setting a new standard of expectations for children's hospitals to have those services available empowers us to advocate more effectively for child life in the future.
Now I'm 19 and I've been cancer-free since April 24th of 2017.
The Association of Child Life Professionals is extremely dear to my heart, not only because of what it did for Mandy, but what it can do for other families. Every single family should have the opportunity to have one with them the moment they step onto a hospital campus.
The work of the child is to be a child, and it's joy. And so to be able to restore a little of the innocence, even in the most overwhelmingly difficult situations that a child and family is facing, is an extraordinary gift, and it's a gift that's provided every day by our Child Life colleagues.